Okay.
All right, so this is a tape job for knee hyperextension. Knee hyperextension, typically there'll be a force to the anterior aspect of the knee, forcing the knee posterior into extension, and then because of that force, it usually goes into hyperextension. So there'll be any stress and strain to the posterior soft tissue, as well as any ligamentous structures inside the knee. So we want to take them out of the point of pain and begin to bend them to where they don't have pain anymore. So let's say he gets to about 15 degrees. Before we start, again, light dusting of tough skin. If we have to, leg is shaven, free of debris and perspiration. And then we also can put a little lace pad in popliteal space so there's no irritation in the back of the knee. We'll do 2 turns of the pre-wrap about mid-calf. Same thing about mid-thigh. Okay, so if this doesn't move, I can quickly put an anchor down here to hold it. Okay, all right, about mid-thigh, we're going to do the same thing. Okay, so I have him at maybe about 15 degrees of knee flexion. Okay, I'm going to run some strips from distal to proximal. Okay, so that it acts like a restraining strip. So as his knee wants to extend, these strips are going to help hold him from pushing back and extending. It's also going to give him some biofeedback so his body can react in a more natural way. So I want to measure how far it is from his distal segment to proximal segment. Okay, and I'm going to go a little bit past those pieces. All right, I'm going to lay down a couple strips. I want my total width of my strip to be at least 2 inches. So this is 1.5 inch tape. If I overlap a couple pieces, I'll have that width that I'm looking for. But again, I also want to continue to make sure that length is appropriate. So 3 to 4 strips, we'll put down 4 here. All right, you first put it on the distal segment. Okay. Why is the tape extended past that anchor? Okay, so that when I go and fold it like this and have it folded down, I can now fold it up here, and if it does begin to slip, it'll kind of catch on itself, and it's just got a better way of holding the tape together, the tape job together. Certainly, as I'm pulling a full anchor as well, I want to have him push down into the table so it engages his calf a little bit, so the muscle activation during that. All right, so now I'm thinking about I'm pulling up, all right, more superior fashion, which should in essence bend his knee a little bit. Okay, same thing, I'm going to put it up on the superior anchor. All right, I'm going to have him contract his quad a little bit. When I put one anchor down, take that tape, hold it back. Okay, in this regard. Another thing I can do to help strengthen this too is kind of fold the edges of the tape. By folding the tape on top of itself, we increase the tensile strength. Last thing I want to do, one of the last things actually is put an X over top of this as well through that space. All right, so I have a lot of restraining material between the distal and proximal segments. Have him contract his quad, put a couple closure strips on there. This is an area that's going to get a lot of force, so if it's something that this is not as effective, I can use elastic on. I can even use moleskin to help hold this on. But this is a simple tape job for knee hyperextension.